Is that you? Yeah?
I know.
I want to be like you, big man. I see you shining.
I know.
It's mad. You know, I see you. I see you. Okay.
I know.
Okay.
I'm back, fam.
Alright,
I'm back.
Alright.
Hey guys, my name is Hopkins Langler and I'm a sports therapist, and welcome back to another YouTube video. And for today's video, I'm going to be tackling an injury that many athletes get, and that is jumper's knees. Before I start this video guys, please make sure to like, subscribe and share this video to all your friends who experience an injury, who currently have an injury, or just want to learn more about how to fix injuries. Also, make sure to follow me on Instagram and Twitter. This is where I post updates in terms of my life, my career, and giving you guys updates in terms of when I want to post a video. And also maybe sometimes I might do certain suggestions in terms of what video I should make next. Either it might be injury related, or about myself, or just about general knowledge really. Now, let's get into the video. A couple years ago, I did experience jumper's knees. I developed this condition a few months after my ACL surgery. And the reason why I had it is because I went back into play sports way too early, and plus I had a big muscular imbalance around my legs. So with my ACL surgery, they took a piece of my hamstring to replace my ACL. So that already weakened my hamstrings. So there was so many issues around it, and it led to me not being able to play sports. In fact, not being able to walk. There was a day where I wasn't able to get out of bed. I had to stay in bed for half a day. And at that point I knew there was something really, really wrong. So then I went to go see a sports therapist, and they showed me the correct exercise and stretches to do, and he told me to not play sports, just be inactive and just do the exercise I tell you to do, and within a month and a bit you'll be fine. And the time frame he gave me, he was right. After that I was able to run, play sports again, no knee pain at all. So I'm here to share the same information to help you guys. Now, the correct term for jumper's knee is patella tendinopathy. Now, tendinopathy is a degeneration of the tendon. And usually the way jumper's knee occurs is due to the overuse of the patella tendon. And the patella tendon is the tendon that you found right below your kneecap. So the symptoms you're going to be experiencing with jumper's knee are that you're going to be experiencing pain when you're running, walking and jumping. You're going to find it quite hard to straighten and bend your leg. And also all the pain you're going to be experiencing is going to be below your kneecap. And it might be tender and it might be a bit swollen. Jumper's knees is very common in athletes such as basketballers and volleyball players due to the fact that they're jumping so much and running a lot as well. This will lead to an overload of the patella tendon and will lead to microscopic tears that happen and eventually causing the pain. And there can be situations where there can be a lot of microscopic tears where the person's not actually feeling pain until a couple months later. There are two other factors which cause patella tendinitis as well, such as tight muscles, for example tight quadriceps and hamstrings, and also muscular imbalance, so the muscle around your knee. So for example, weak quads, strong hamstrings might cause the pain to occur. So if we can fix both of these issues with the other issues as well, we're going to be able to progress the person to fixing the injury, get rid of the pain and being injury free. I'm going to be showing you guys a few exercises and stretches you can perform to relieve this pain and also get rid of this injury. Now, before I get into the exercise, what I will say is this. If you guys are very active during your week, you might need to reduce your activity levels. So if you have time after this video, guys, just write a plan, see how long you're at work for and how often you exercise. If you exercise 5 times a week, try and maybe reduce that to 3 or 2 for a couple of weeks. That it gives you enough time to rest and go through these exercises so we're able to get rid of the pain and heal the tendon. Alright, so for the first exercise I'm going to show you guys, foam rolling. At this point I need to make my own foam roller because I'm using this every single video. But I promise you guys, this will change your life. If you're experiencing lower back pain, leg pain, all of that stuff, this is something that you need. Self-manufactured release is very, very essential. So same principle applies. We're going to do foam rolling on the quadriceps and the hamstrings. So place here on your quadriceps, put down it, and then go along the whole muscle belly of the quadriceps. Come back and do it again. And then when you find a tight spot, what you need to do is just stick to it and then rock on it left and right, up and down, until you feel the pain eases, and then continue to foam roll. And also with the quads, there are 3 main parts. There's the middle section, Then there's the inside, and the outside. So next I'm going to foam roll the hamstrings. So same principle applies. Placing your hamstrings and then roll and come back. Also remember that the hamstrings, there are 3 sections to target as well. So aim it on the outside aspect, and when you find a tight spot, hold it, rock on it left and right, up and down, and also the inside. The reason why we slightly alter the angle of the muscle so that we're able to target all the muscle fibers and we're able to work on all of them. So I suggest you spend roughly a minute on each muscle so you're able to get the full effect of the self-myofascial release and get a good proper session on the muscle so you get preparing it for the rest of the workout. So this next exercise I'm going to show you guys is a hip flexor stretch, and it's really going to help you out with the tightness around your quads. Now it's very easy to do. What you're going to need is a wall. Place the foot that you want to stretch on the wall here, and then your other leg, straighten it out and straighten out your body as well and hold it. So hold this stretch for 30 seconds. So the good thing about this stretch is that it's going to help you see your progress. So for example, as you get more flexible, you're going to be able to bring your knee a lot more closer to the wall. So for example, for me, I'm going to try and bring it here. And then raise it up. As you get closer to the wall, it's going to get a lot harder, but you're going to feel a lot much more of a stretch. So make sure to do it on both legs and also hold the stretch between 30 to 40 seconds and do it 4 times. So the first exercise I'm going to show you guys is the glute bridge, and it's going to work a lot to improve the muscular imbalance around your legs. So we're going to be targeting your glutes, and very easy to do. You just get on the ground, go into your back, and then push up, and make sure that when you get to the top here, that you're squeezing your glutes, and then come back down slowly. Make sure that you don't touch the ground. You get as close to the ground as possible, and then shoot straight back up, and then come back down. Shoot back up again, and when you get to this stage here, just hold it for 2 seconds, then come back down. And once that gets too easy, we can just progress it to a single leg glute bridge. So kick out your leg here, and then same principle applies. Make sure to squeeze your glutes. When you get to the top here for 2 seconds, come back down, push up again, come back down. Same principles apply. I suggest that you do 4 sets and 12 reps of this exercise. So for the second exercise, we're going to perform a donkey hydrant. Again, this will help to strengthen up the glutes so that we're able to correct this muscular imbalance that we're experiencing. Now all we need to do, go on all fours, and then with the leg that you want to target, kick out up here, come back to the middle, and kick out to the inside, and out. So kicking out this way and the other way, that counts as 1. Make sure that you're performing 12 reps, and make sure to do it with both legs as well. And to progress this exercise to make it harder, what you can do is time it. So for example, maybe it takes you 4 seconds to do this motion, then 4 seconds back, and then 4 seconds this way, and 4 seconds back. So I suggest you perform 12 reps and 4 sets of this exercise, and make sure to do it in a controlled manner so you're able to get the full effect of it. So the next exercise we're going to perform are eccentric squats. Now the benefit of performing eccentric exercises, especially for patella tendinopathy, is that it's going to allow to load the tendon under tension. So we're going to be able to strengthen up the load and also heal it. So you're going to need something to elevate your feet. So you could use either a towel or an elevated surface anywhere at home. I don't have any of that, so I'm just using a towel. Roll it up so that's elevated. Place on the ground. Feet, legs shoulder width apart. And then for your squat, make sure to slightly kick out your glutes, keep your back straight, and also make sure that your legs aren't wobbling inwards or outwards when you're squatting down. You keep it straight. and you go down. So do you count down to 5, and when you get to the bottom here at a 90-degree angle, hold it for 2 seconds, then come back up. And we're repeating the process. If you can go further down, then do so. Hold it, then come back up. I suggest you perform between 8 to 10 reps of this exercise, and if this is too hard, you're not able to do it because of your jumper's knees, what you can do is implement seated squats. So you can get a chair and still perform it elevated as well. Slightly touch the chair, then come back up and repeat the process. And again, with those, perform between 8 to 10 reps of this exercise. So the next exercise we're going to perform are Bulgarian split squats. And the benefit of these exercises is also an eccentric exercise for your quadriceps. So all you're going to need is either a chair or a bench, an elevated surface where you can place your foot. And then what you need to do is lower yourself down within 5 seconds. So, and when you get here, hold it for 2 seconds, and shoot back up, and perform it again. I suggest you do between 8 to 10 reps of this exercise and do perform it in 4 sets. And that is how you treat jumper's knees. Now guys, please make sure to follow all of these exercises and the advice I'm giving you. And I promise you that within a couple of weeks that your pain's gonna go away. And this is only gonna work if you reduce your activity as well. The benefit of this lockdown, I'll say, is that it's led to a lot of people giving them time to rest. And especially a lot of athletes. Some athletes keep playing through the injuries where sometimes you just need time to rest and just do correct exercises so you're able to get yourself good for the next season. So please guys, be patient, do these exercises, and I promise you're gonna see some results. Please make sure to like, subscribe, and share this video to anyone who's experiencing knee pain, or in fact anyone who's experiencing any injuries. Comment below if this video has helped you, and also suggest any ideas that you want me to do next for the next video, what injuries you want me to tackle, or advice that you guys want me to share. And also please follow me on Instagram and Twitter where I'll be posting updates in terms of my life, my career, and also when I'll be posting the next video. And also potentially sometimes I might start a few debates there. Thank you very much and have a nice day guys.